YouTube channels and other official social media account. I welcome everyone for today's Media Forum, July 12, 2021. And to give us the latest updates on our COVID-19 response and other public health services, here is Undersecretary Maria Rosette Singverhere, also our DOH official spokesperson. Good morning po, ma'am.
Good morning, Lindsay, at magandang umaga po sa inyong lahat. Happy Monday to all of you. Sa kasalukuyan po, nakakaranas tayo ng pagplateau sa kabuuang bilang ng mga kaso ng COVID-19 sa ating bansa at nananatili pa rin pong very fragile ang ating sitwasyon. Ang patuloy din pong paglaganap ng mas nakakahawang variants sa ibang panig ng mundo, kaya ay mas nangangahulugan na dapat po patuloy po tayo lahat na nag-iingat laban sa sakit na ito. Napakahalaga po sa panahong ito para lalo nating mabantayan ang ating borders laban sa variants, ang pag-igtingin po natin ang pagresponde sa ating mga kaso sa pamamagitan ng ating PDITR strategies. Palawakin po natin ang ating pambansang pagbabakuna kasabay po ng pagsunod natin sa minimum public health standards. We are in the race against these variants. Ang kooperasyon po ng bawat isa sa atin mula sa pamahalaan hanggang sa bawat sektor ng pamayanan at bawat individual at pamilya ay malaki po ang maitutulong para tuluyan po nating maipababa ang bilang ng mga kaso sa ating bansa, mapigilan po natin ang pagpasok ng mga variants at saka atin pong mabigyan ng proteksyon ang buong populasyon. Ngayong buwan din po ay pinagdiriwang natin ang National Disaster Resilience Month. Ang tema po nito ay nakatuon sa mahalagang ginagampanan ng mga tamang pamamahala, kahandaan, kaalaman at pakikipagtulungan laban sa pandemya at sa iba pang mga sakuna na maaring kaharapin ng ating bansa. At para talakayin po ang ating health resilience in this new normal, makakasama po natin ngayong umaga si Director Ronald Lo ng DOH Health Emergency Management Bureau. Ron, you have the floor.
Thank you, Yusek, our CMU and media partners and colleagues from the DOH. At this point, may I share my screen po? All right. So again, I'm glad to be talking about this topic of health resilience in the new normal. Every year, every month of July, we celebrate the National Disaster Resilience Month. I know that you're already familiar with resilience in relation to emergencies and disasters, but with our COVID experience, in the era of what we call the new normal, we have to know better what resilience is all about. So for this morning, please allow me to shed light on three things. First, why do we concern ourselves with health resilience? Second, how does the DOH fulfill its mandate in health resilience? And third, what are ways forward to make health resilience happen? So this is not only for DOH to push, but all stakeholders, especially including you, all of us will need to work on this. So I really hope this presentation really helps. Tamang pamamahala at kahandaan, kaalaman at pagtutulungan sa sakuna at pandemya ay kalasag ng bayan. So this is our theme of our celebration this year. So this talks about good governance, preparedness, knowledge, and collaboration. So we know these are the elements needed for us to be secure from emergencies, disasters, and pandemics. We know this is not just wishful thinking. We need to do this, and we know we can do this. And the headline today, the cartoon says it all. So as if the threat of COVID is not enough, some of our fellow Filipinos have to contend with the problem of a volcanic eruption that is looming. So scenarios like this should really inspire us to do better in our disaster work and COVID-19 response, and in general, in disaster resilience. In the context of health, this should be very concrete as we embark on initiatives to make our health system more resilient in the time of COVID-19 and even beyond. It is common knowledge that the Philippines is full of hazards that can become emergencies and emergencies that can become disasters when not properly addressed. From typhoons, volcanic eruptions, earthquakes, even armed conflicts to, of course, pandemics. This add up to our health issues. So this can increase deaths, diseases, disabilities, and injuries among Filipinos. And not only this, disasters can also create negative impacts on our health system. So it can destroy our hospitals. It can claim the lives of our health personnel. It can deplete our health resources. So in short, this can compromise our service delivery. It can also affect our health system development, and much worse, it can even undermine the gains that we have in the context of universal health care. So because of this, the health sector should really address disasters very strategically. Health resilience is part of the mandate of the health sector, from the UN Sustainable Development Goals to the Sendai Framework for DRR, which is our blueprint when we talk about DRR, to our Philippine Development Plan, to our Republic Act 10121, or what we know as our Philippine Disaster Act, to our Republic Act 11223, our Universal Healthcare Law, and even our national objectives for health and our Formula 1 Plus for health, and even DOH policies on disaster risk reduction in health. So we can say that health resilience is pretty much well established in international and national frameworks and policies. So this can provide us with all the guidance that we need. The Department of Health is deliberate in pushing for health resilience. So it's worth noting that in our current strategy framework, the pyramid on the left, the current DOH mission includes resilient as a characteristic. So I hope you can see that. So this is to be supported by the pillars on financing, service delivery, regulations, performance accountability, and governance. Meanwhile, the diagram on the right shows that a resilient health system is surrounded by the different building blocks. We call this the building blocks of the health system. So here there's governance, financing, medicines, health information, and so on and so forth. So all of this need to be strengthened. These have to be managed in the context of social determinants of health. So these are the big forces that shape health, like poverty, education, etc. And you can also see here health emergency programs, a strong coordination platform, and community resilience. So at a broader level, health sector strategies run the whole gamut of health disaster risk reduction, or this is the prevention aspect. We also have health disaster preparedness, emergency health response. This is very important. And of course, health system recovery. So health resilience is thus holistic. And yeah, multiple factors need to be addressed and considered. Although this is a huge challenge that the health sector must do, we need to continue doing our job of protecting our people and making them healthier and more resilient. Seeing health resilience as an end, there is a need to institutionalize DREAM-H. So this stands for Disaster Risk Reduction and Management in Health. So we look at this as the means to achieve health resilience, if that is an end. So by definition, DREAM-H is an integrated, systems-based, multi-sectoral process that uses policies, plans, different programs and strategies just to reduce the health risk of disasters. And here we try to prevent exposure to hazards. We reduce the vulnerabilities of communities and improve the response and recovery capacities of community and of course response agencies, including the DOH. So DREAM-H consists of different activities in what we call the thematic areas. So we have prevention and mitigation, preparedness, response, and recovery and rehabilitation. So a comprehensive DREAM-H program should be developed in order to achieve health resilience. And this should be done at all levels of our health system. DREAM-H is part of our UHC law. A functional DREAM-H system consists of 4 elements. I hope you can appreciate it here. There should be a DREAM-H plan, which should be our guide towards how we program health resilience. We should have health emergency response teams and health emergency commodities, which are important resources in any response undertaking. And even the emergency operations center, which is the seat of command and control, coordination, and communication. So a functional Dream Age system is crucial in improving preparedness and response to any public health emergency, including the pandemic. So we are endeavoring to institutionalize Dream Age in all local government units with a particular emphasis on provinces and cities as part of the UHC law. So our office, the Health Emergency Management Bureau, is primarily responsible for doing this. The Department of Health through Dream Age is doing prevention, preparedness, response, and recovery and rehabilitation to reduce the health risk of disasters. We put premium on strengthening our public health systems through investments in resources. We capacitate leaders and managers and also improve governance, among others. We enhance the capacity of the health sector for preparedness and response to emergencies through policy development, planning, technical assistance. Since hospitals and health facilities are critical infrastructure that are needed to deliver our services, we look at their structural integrity and preparedness so that they can address cases even in times of increasing demand because of surge. And this is a high priority right now. We improve response to public health emergencies through trainings, exercises. We also improve the use of early warning systems to effect immediate response and to protect our people from hazards, as we do with typhoons entering our Philippine area of responsibility. Lastly, we ensure that local capacities are developed, local systems are resilient to the impacts of any public health emergency, because at the end of the day, they are the first responders. So in our DreamH program, in collaboration with different stakeholders like you, we are doing many activities in relation to these key actions. The Department of Health envisions health resilience at the community level. So it is also strategic. We are strategic in turning this into a reality. So as disaster risks increase, we're looking at local practices. This can offer some good practices and solutions, but we need to document these local practices so we can use that in our concept of resilience. So from merely responding to disasters, we are always doing this, to doing preparedness, we are focusing our attention also on building resilience. So with health disaster safety in the community, or 5K, as you can see here, kaligtasang pangkalusugan sa kalamidad sa kamay ng komunidad as our vision, we know that health plays a central role in building resilience. So what is our plan now? So we are trying to establish some proof of concept to demonstrate good practices of community resilience at the LGU level. So we know of so many good COVID-19 practices now. In line with this, we are committed, the DOH, in supporting the local governments through 5K. So kaalaman, so we help in imparting knowledge, providing support in risk assessment and conduct of advocacy activities. Kasanayan, we are providing skills trainings for saving lives, like basic life support, first aid, kahandaan, planning, systems development, testing, and our system of learning from lessons. Kagamitan, so this is logistics and other resources. And kapatiran, partnership and linkages. So in short, 5K is both a vision and a strategic framework to the Department of Health. How do we move forward? So in the context of health resilience in the new normal, I think we need to draw some parallels between our COVID-19 response and our usual efforts of addressing emergencies, especially natural disasters. These are our thrusts now to achieve health resilience. First, we want to sustain our capacity development initiatives to enhance the competencies of our health human resources, strengthen our health system in terms of its building blocks from money, information, governance, logistics, and everything just to improve our capacity to deliver our health services in emergencies and disasters. So since Dream Age institutionalization is crucial and health resilience is hinged on this, we want to improve our communication and advocacy to reach out to more local government units, more local chief executives, so they can already initiate health resilience at the community level. We also want to reach out to more partners like you to help us communicate this message. Finally, we have to explore better ways of collaborating with more partners inside and outside the DOH, within and beyond the health sector. And of course, not only to get what we need, but also to build synergies so that we're able to maximize the benefits of all our actions. Everything for health resilience. So we've been doing this before COVID-19. These are all being done now in our COVID-19 response. And this we also need to sustain, guided by the spirit of the Universal Healthcare Law. So I hope this is clear. As we spend the rest of our July, we enjoin you to get involved in these different DOH and DRM activities and continue to champion health resilience. So to mention, we've launched NDRM in the DOH. We are conducting a survey of DreamH awareness among UHC implementation sites. We are participating in the virtual mass CPR readiness campaign. We are doing a recall on the survey on the recall of DreamH activity by the community. And we're going to conduct a tabletop exercise on public service continuity focused on vaccine operations. So this is an important aspect of our COVID-19 response now. And also, we're going to organize a public service continuity planning orientation for DOH officials. In the different regions, fora and summits are also being done on DreamH and health resilience. So in fact, I should say that activities like this are happening not only during July, but all year round, even when there's no NDRM. After all, we know that health resilience should be massively advocated and widely practiced every day, all the time, so that we'll be able to achieve our vision of a healthier and more resilient Philippines. And if you ask me in the context of COVID-19, of course, we don't want nothing else but a brighter future in the new normal. So in summary, I've discussed what health resilience is all about, what steps the Department of Health had been taking to lead health resilience in the health sector, and what trust the DOH currently has to move forward. Thank you everyone for your kind attention, and I'll be glad to answer your questions later. Good morning. Thank you, Madam Chair.
Thank you very much po, Director Lo. Since we do not see any questions po from the media, or meron po ba tayong ihahabol pa po na questions for Director Ron? If none po, Doc Ron, baka meron po tayong mga pahuling paalala po sa ating publiko and of course to our local government units when it comes to preparing po for disasters, especially now na tag-ulan na naman, and of course we are, yun nga po, may recent activities po yung sa Taal Volcano.
So right, so we know the typhoon season is officially in, no, and Taal eruption is looming. And of course, we are still deep in our COVID response. So again, governance is important, as is the theme of our NDRM celebration. So the government is doing everything that it can, no, with the support of stakeholders to make health resilience happen. But at the end of the day, so many things can come at the level of the community. So we also must build resilience as well, no? Starting from the local government unit. So everyone's role is very important in this important undertaking. So we hope we stay safe and really be healthier and more resilient in the new normal. Thank you.
Thank you very much po, Doc. Yusek?
Thank you, Director Ron, for the updates that we have given to our media and the public. Maraming salamat.
Thank you rin po for this opportunity. Good day.
Thank you.
Ma'am, I will now be reading po the questions from our media sent to us po over the weekend po.
Go ahead, Lindsay.
From Marites Iliano of Sunstar Philippines, UNICEF Philippines said that the DOH has acknowledged that the June 10 shipment consisted of 2.2 billion doses of Pfizer as committed by COVAX, not 2.276820 as initially reported by DOH. Will DOH issue a statement to clarify this and set the record straight as far as vaccine deliveries are concerned?
Yes, no, Marites, nag-issue na ng memorandum ang aming supply chain management office nung July 2 regarding this discrepancy. Based on the inventories, yung 3PL service provider natin reported that there were actually 4 trays in a tertiary packaging initially labeled as 2 trays. So nung binuksan nila, they discovered na merong 4 na trays instead of the 2 trays. So the actual quantity of Pfizer doses that has arrived in the country is 2,472,210, as opposed to the initially reported by COVAX, which was 2.2 million, no? 2,279,160 doses. And as opposed also to the initial report coming from DOH that it was 2,276,820 doses. So ang final natin based on the inventories is 2,472,210.
Thank you po, Yusek. DOH Central Visayas officials said that the region, particularly Cebu City and Cebu Province, is on its third wave of infections. Is PGC or NIH undertaking genomic sequencing of samples taken from the region to determine whether a VOC is driving the sustained rise in cases?
Yes, no. So Central Visayas naman is always included in our whole genome sequencing. And for the latest data natin, meron sila na na-identify na sa kanila na variants of concern. Kailangan natin linawin, kapag may mga pagtaas ng kaso sa isang lugar, ang variants of course would always be a major factor. Pero kailangan isipin natin multitude of factors lagi. Na andyan yung mobility, na andyan yung border controls, na andyan yung compliance to minimum public health standards, na andyan yung safety protocol sa mga workplaces at saka establishments. So lahat ng ito contributes to our drivers, no, of increase in the number of cases. Now for the Central Visayas declaration or pronouncement, makikipag-usap tayo sa kanila, no, regarding this matter. Although we have verified their numbers already, ganito po na meron silang mga granularity in their analysis. Nakita nila that in specific areas in their region, as what has been mentioned, Cebu City and Cebu Province, nakikita natin na meron talagang pagtaas. And we are reporting that in our situational report. At nakita po natin na unti-unti po na pagtaas, na wala na yung pagbaba at plateauing of cases dito sa mga lugar na to. So we still need to further verify so that we can have one message for this rise in cases in Central Visayas.
Thank you po, Yusek. From Claudette Mocon Siriaco, based po sa record ng DOH, ilang LGUs po ang nagsuspend ng pagbibigay ng first dose dahil sa pagka-delay ng pagdating ng Sinovac vaccines. Kailan po expected na dadating ang supply? And makakaapekto po ba ito sa target na ma-achieve ang herd immunity by November 2021?
Claudette, actually walang suspension. Ang nangyari, yung mga LGUs na wala ng pang first dose dahil na-delay nga yung supplies natin, second dose naman ang kanilang ginagawa. No? So yun yung kanilang focus at yun yung naging utos na yung mga supplies natin, tapusin natin yung mga per second dose para mas marami tayong fully vaccinated individuals. May iba namang LGU, may supply pa rin sila, kaya lang kulang na rin, pero tinuloy pa rin nila yung pagpa-first dose nila. So if it's going to be affecting our herd immunity goals, sa tingin ko hindi. Kasi yung delay natin is just 1 or 2 weeks. Dadating na uli ngayong linggo ang mga Sinovac vaccines at iba pang mga bakuna for this week. And I think we can be able to achieve yung sinabi ni Secretary Galvez, no, na kung ilang bakuna ang darating sa ating bansa ngayong buwan, which is 11.5 million yung sinasabi niya. Parating na kasi halos lahat ng mga supplies na kailangan natin for this month.
Thank you, Yusek from Aiko Miguel. Booster shots versus Delta variants still need definitive evidence, but health officials from Thailand, Bahrain, and the United Arab Emirates have already decided to offer the extra dose to some people already inoculated with vaccines from Sinovac and from AstraZeneca. What is the DOH's plan here in the Philippines, considering we still do not have enough and stable COVID-19 vaccine supply from various vaccine manufacturers and from COVAX?
Well, Aiko, katulad ng lagi namin sinasabi, lahat ng ating mga polisiya at saka strategies na ginagawa, these are all based on science and evidence. And sa ngayon, wala pa kaming pinangahawakan na kumpletong ebidensya at siyensya na pwede tayo magbigay nito mga booster shots na ito. Ang lagi natin iisipin, ang paramount sa gobyerno ay ang safety ng ating mga kababayan. So hanggang wala pa hong pinangahawakan ng ating gobyerno kasama ng ating mga eksperto ng sufficient evidence to say that it's going to be safe and effective for our citizens, hindi pa ho natin mairerekomenda yan sa ngayon. So booster shots is still not recommended. Pangalawa at napaka-importante, sana po isipin natin na hanggang wala pa ho namang ebidensya itong booster shots na ito, bigyan natin ng kumpiyansa ang ating mga bakuna dahil lumalabas naman po na sa ngayon ang mga real-world studies na nagpapakita na lahat ng ginagamit nating bakuna dito sa ating bansa ay effective sila against hospitalizations, against ICU admissions, and against deaths, and even effective against symptomatic infections. Nakapagpakita rin tayo ng mga datos na sa lahat po ng nabakunahan dito sa ating bansa, fully vaccinated, lahat po ng nagkaroon ng tinatawag na breakthrough infections, yung infection after 2 weeks of being fully vaccinated, ay napakaliit na numero lang at lahat po ay mild cases. So pangatlo, gusto rin ho nating paalalahanan ng lahat, hindi pa ho lahat ng ating mga kababayan o yung mga kapitbahay nyo at mga kamag-anak nyo ay nabibigyan ng bakuna. So sana po, let us try to wait for direct evidence and science before we can go into that direction of having these booster doses. Let us give chance to everybody to receive these vaccines and then we will talk about booster shots.
Thank you po, Yusek. From Sheila Crisostomo and Lay Alvis, mayroon daw po ba tayong data kung ilang minors ang nagkakasakit ng COVID-19 sa bansa and kung nakakapag-observe daw po ba tayo ng pagtaas ng kaso sa mga bata? Tapos ano daw po ang paalala ng DOH ngayong pinapayagan ng makalabas sa outdoor areas ang mga batang 5 years old pataas?
Yes, Lay, no, yung ating med datos tayo ng mga 0 to 19 years old. Ito yung mga kino-consider natin na part of our pediatrics group. So pag tinignan po natin itong datos na ito, ang matataas na bilang po ng mga nagkakaroon ay less than 2 years old. And as the age increases, pagdating ng mga 15 years old hanggang 19 years old, doon pa rin nakikita natin na mas mataas kumpara sa ibang mga age groups. So pag tinignan ho natin itong datos na ito and based from our data currently, proportional po ang pagtaas ng mga kaso across all age groups. Wala po tayo masyadong nakikita na pagtaas nito mga kaso among our children. Ang paalala po natin sa ating mga nanay at tatay, mga lolo't lola na sasama sa ating mga kabataan pag lumabas, kahit po natin pinayagan ang ating mga kabataan lumabas, kailangan meron pa rin tayong safety protocols, kailangan susunod pa rin tayo sa existing protocols. So kung halimbawa lalabas po ang bata, 5 years old and above, kailangan po nakamask, kailangan binabantayan ng kanilang mga magulang o kaya caregivers, kailangan hindi pupunta sa matataong lugar, kailangan as much as possible maintain your bubble, no? Baka biglang nagsasama-sama na different bubbles dun sa pinupuntahan ng mga bata, isa rin po yan na pwedeng maging risk para magkaroon ng infeksyon ng ating mga kabataan. So ingat lang po tayo, ang atin po naging objective sa pagpayag na paglabas ng ating mga kabataan is because of science and evidence na meron na po mga studies ngayon na lumalabas ng ating mga kabataan ay affected na ng pandemya at mga lockdown. Nagkakaroon na sila ng issues both physically and mentally at yung kanilang developmental stages ay nahahamper at naapektuhan because of the lockdowns because they cannot interact properly with other people. They do not see other people. So medyo nagkakaroon na tayo ng issues kaya nagkaroon tayo ng rekomendasyon base sa mga eksperto na kasama natin. Pero hindi po diyan ibig sabihin na binibigyan na natin ng laya na sobra. Kailangan susunod pa rin po tayo sa mga pamantayan ng ating gobyerno para mabigyan pa rin natin ng wastong kaligtasan ng ating mga kabataan.
Thank you po, Yusek. From Cristel, hindi po ba pwede na magsagawa muna ng skin test sa mga babakunahan, particularly those with comorbids, known allergies, and seniors? Have we thought ways to prevent cases of severe vaccine reactions?
Cristel, unang-una, wala po tayong way para ma-determine o any test available para masabi natin kung sila ay allergic to specific components of these vaccines. So meron pong tatlong major components ng iba't ibang bakuna. Matatagpuan sa iba't ibang bakuna na are possible na nakakapag-cause ng allergic reactions. And base po sa ating mga eksperto ng allergy dito sa ating bansa, yung mga allergologist po natin, wala po tayong known na laboratory test or any kind of mechanism for us to detect kung may allergy ang isang tao, hindi. Kaya nga po, kung mapapansin nyo, kasama sa ating protocol, yung screening. Napaka-importante kasi kailangan mabanggit ng ating mga kababayang magpapabakuna kung sila ay nagkaroon na ng experience of this kind of allergic reactions nung sila ay nabakunahan ng ibang bakuna in the past. Pangalawa, meron pa rin ho tayong monitoring 15 to 30 minutes after being vaccinated para masiguro natin na yung magkakaroon ng mga immediate reactions ay natutugunan natin agad-agad. Ang atin pong mga bakunador ay nagbabakuna na decades already. Kahit po nung wala pang COVID-19, nagbabakuna na po sila ng mga pangbakuna pang bata, pang matanda at saka mga adolescents. And trained po sila lahat to identify or to detect serious adverse reactions such as anaphylaxis or allergies, at alam po nila ang kanilang gagawin. Equipped din po ang ating lahat ng vaccination sites maaring ibigay immediately sa ating mga babakunahan na magkakaroon ng ganitong mga pagkakataon ng allergies. Kailangan din maintindihan ng ating mga kababayan, napakaliit na porsyento po ng ating mga kababayan na nakakaranas ng ganitong mga allergies with regard to these vaccines that are available currently for COVID-19.
Thank you po, Yusek. Another question from Cristel. Have we coordinated with the social media companies to track down posts that lead to vaccine hesitancy or other way around to post posts about the importance of COVID-19 vaccines? Ano na rin po ang progress nito?
Yes, we are doing 24/7 journalism, if you will call that, kung saan binabantayan namin lahat ng lumalabas na artikulo at pag nakita natin na inaccurate ang kanilang mga pinopost o di kaya ay makaka-lead sa vaccine hesitancy because they are misleading the public, tinatawagan natin agad itong mga social media companies na ito. Pangalawa, meron po kami nung check the facts. Nandyan po yan sa aming mga social media platforms kung saan inumpisahan natin to noong April 7. Dito po namin ipinapaliwanag ng maayos ito pong mga lumalabas na mga misinformation or disinformation sa social media para better inform po ang ating mga kababayan.
Thank you, Yusek. From Greg Gregorio, the country has been battling the pandemic for over a year now. What do you think are the good measures that are already in place? Also, with recent low rankings given by international entities to the Philippines based on our COVID-19 response, what aspects do you think we are lacking and what other plans do we have in order to better address the situation?
Yes, Greg, so nakita naman natin mula nung nag-umpisa tayo, nakapagpakita naman tayo ng improvements in our healthcare system at kung paano rumisponde ang ating buong gobyerno dito sa pandemic na ito. So unang-una, gusto ko lang sabihin that we have done this whole of government and whole of society approach dito sa ginagawa nating response for COVID-19. Kung mapapansin nyo, hindi lang po health department ang umaakto dito sa ating mga sinasagawang response. Kasama po natin ang lahat ng national government agencies, kasama rin po natin ang NGOs, development partners, and the private sector as well. Napakalaking bahagi ng private sector dito sa ginagawa po natin. Pangalawa, pinakita po natin that national government enables and local government leads. So binigyan po natin ng ganung authority ang ating local government, sinuportahan po natin sila para i-lead nila yung response sa kanilang lugar. At nakita po natin kung gaano nila binigyang halaga or value yung binigay sa kanilang role or assignment. At saka nakita natin kung gaano nila pangalagaan ang kanilang mga constituents. Pangatlo, tayo po ay nakapag-invest at nakapagtayo ng mga iba't ibang structures or facilities so that we can expand our capacity to address this pandemic. No? So dumami ang ating mga laboratorio, dumami ang ating mga quarantine facilities, nakapag-expand tayo ng mga kama sa ospital, nakabili tayo ng mga highly technical na mga equipment para sa ating ospital at mga laboratorio. Meron tayong whole genome sequencing na gumagana ngayon. Nakapagdagdag po tayo ng mga cadres or healthcare workers sa iba't ibang bahagi ng ating bansa. So ito po lahat, aside from the other things that we do, sa tingin ko, are major things that we have done so that we can address the pandemic. Kahit kailan hindi ho namin sinabing perfecto tayo. We always say that yes, lahat ng nakikita natin o naibibigay sa ating mga puna o di kaya ay opinion galing sa mga artikulo, bukas po ang ating gobyerno para pag-aralan at baka makapulot din po tayo ng mga pwede pa nating i-improve sa ating response. Pero sana po hinihikayat din natin this kind of surveys are good because they can provide inputs also to what we do in government for us to address this pandemic. Pero yun pong when we try to compare and pinapakita po na laging nasa huli o di kaya ay second to the last, sana po let's just focus on what we're doing here in the country. Pag-igtingin pa natin, magtulong-tulong tayo at ito pong mga ganitong klaseng mga surveys o di kaya ay mga opinion na dumarating sa atin, ginagamit naman natin for us to further improve on what we are doing currently.
Thank you po, Yusek. From Caroline, meron na naman daw pong nag-viral na video ng mga nagpa-party. May magiging investigation po ba dito?
Yes, Caroline, just recently DILG has released itong kanilang policy na nagpakita kung ano yung mga penalties, ano yung mga violations, ano yung pwedeng isanction sa mga taong nagva-violate ng ating mga public health standards. At kasama po sa public health standards yung mass gatherings na pinagbabawal ng husto sa kalagayan ng ating bansa sa ngayon. So ito po ay imbestigahan ng ating Department of Interior and Local Government, and those involved in this specific incident will be penalized.
Thank you po, Yusek. Sa breakthrough infection sa Thailand, a nurse has died and other medical worker is in critical condition even after receiving Sinovac. An expert panel has recommended a third dose to trigger immunity for medical workers who are at risk. Do we have local data of Filipinos vaccinated with Sinovac getting sick? And should health workers vaccinated with Sinovac get booster shots? How soon po?
Yes, so kailangan natin ilagay sa konteksto ito. Katulad nung lumabas dati na article yung sa Indonesia, wherein they just stated kung ilan yung nagkasakit, ilan yung namatay, pero hindi nila sinabi yung kabuuan ng mga healthcare workers, hindi nila classify ilan yung mild, moderate, severe at critical. So basta nandun lang yung mga datos na yon, and people are left to interpret on their own. And sa tingin namin, yung mga ganito pong mga artikulo katulad nitong lumabas sa Thailand ay hindi nakakatulong sa mga response na ginagawa sa bawat bansa. So sana po kayo po alam ko katulong namin kayo mga media partners. So let us try to take this with a grain of salt. Tignan po natin itong article na to, pag tinignan natin, hindi niya binigay ang kabuuan, numero ng mga healthcare workers, hindi nila classify as to mild, moderate, severe or critical. Hindi nila sinabi ilan na nabakunahan at hindi pa nababakunahan. So these kind of details are very important when we try to analyze if really we can verify na talagang kailangan pagtuunan ng pansin. Pangatlo, kailangan ko rin sabihin na base dyan, pag binasa mo yung article na yan, wala pang official, Lagi natin iintindihin at pinapaalalahanan ko ang lahat. Kapag may nangyayari po na mga reaction sa bakuna, meron po tayo yung tinatawag na causality assessment. Ang causality assessment is an internationally accepted mechanism for you to be able to determine kung iyong pong nangyaring reaksyon na yon ay dahil sa bakuna o hindi. And wala pong binanggit kahit isa dito po sa artikulo na to that there was this kind of process that has been undertaken. So these are initial reports. Of course, kung tinitignan natin, kukunin natin yan at pag-aaralan natin. Pero sa ngayon, it is very premature for us to conclude regarding this matter. So sana po yung ating mga kababayan ay magkaroon ng tamang interpretasyon dito po sa datos na to, nakapagpakita na po ang ating mga bakuna ngayon ng real-world effectiveness at ito po ay taliwas na ilalathala dito po sa mga artikulong ito. Dito rin sa ating bansa ay nakapagbigay na po ng pahayag ang Food and Drug Administration na sa lahat ng bakunang ginagamit natin and for all of those who have received 2 doses of vaccines or fully vaccinated, ang number of infections na nangyari pagkatapos nito ay napakakonti lang po, less than 50 actually. And lahat po ito ay mild cases, walang na-ospital, walang namatay. So dyan pa lang mapapakita na po natin na ito po mga bakunang ginagamit natin sa ating bansa ay epektibo at magiging ligtas po para sa ating mga kababayan. Pangalawang tanong, kung magbo-booster, wala pa ho tayong sufficient evidence and katulad ng sabi natin kanina, aantayin natin na magkaroon ng kumpletong ebidensya para po maging ligtas ang mga ganitong proseso para sa ating mga kababayan. So sana po mag-antay tayo at antayin natin ang rekomendasyon na ibibigay ng DOH pagdating ng panahon na yon. Pangatlo, katulad ng paulit-ulit naming sinasabi, let us give that chance for everybody to get vaccinated first before we think of booster doses. Yan pong booster doses, kapag may science na, may ebidensya ng kumpleto, ay ipapatupad naman po natin. Pero sa ngayon na wala pa, let us have this kind of protocol. Let's align with the protocols at yan po muna ang ipatupad natin.
Thank you po, Yusek. Yusek, I will now be reading po yung mga questions sent to us through the chat box po. From Red Mendoza, would the DOH non-insistence of a travel ban to other countries with the Delta variant detrimental sa ating response? How sure is this policy will allow the country to control the variant? Ma-assure po ba natin ang strengthened quarantine measures?
Unang-una, Red, gusto ko lang i-correct, no? DOH recommends also, but the IATF decides, no? So pinag-uusapan yan. Ibig sabihin, ang sinasabi ko lang, kabuuan, hindi lang po health ang tinitignan natin sa mga aspeto. Lahat yan, security, social, and economic impacts kapag gumagawa tayo ng strategy. So these travel bans, nung tinignan po natin, minapa natin ang mga bansang may Delta variant. At alam po natin lahat, it's actually more than 90 countries already. And for the other variants, ganyan na rin po, no? Like the Lambda variant, na variant of interest pa lang, 30 bansa. And we all know that we cannot isolate our country from all of these countries. Unang-una, may mga kababayan nga po tayo dyan sa mga bansang yan na hindi natin sila pwedeng pigilan na pumasok. Kaya nga ang sinasabi natin, we need to intensify our border controls. This is the very first measure that we need to do. And that is what we are doing right now. At sa tingin namin, nagiging epektibo dahil nakapag-identify tayo ng mga individuals with Delta variant. We were able to isolate them at hindi pa natin nakikitang pumasok sa ating komunidad. Ang mga variants na to, sa tingin namin at sa tingin ng mga eksperto, dadating at dadating yung panahon na makakapasok yan sa ating komunidad. Na itong mga strategies na sinasagawa natin is just trying to buy us time, no? Para tayo ay makapag-prepare, para maging handa ang ating sistema at maging handa ang ating mga kababayan kung sakaling dadating ang panahon na yan. We are very hopeful that our border controls will be able to mitigate, no? Or to prevent and avoid the entry of these variants. But if in case it goes through our borders at may nakapasok kahit isa lang, meron po tayong ibang safeguards na pinapatupad. Kaya nga po meron tayo ng 4-door policy. So aside from travel bans, yan yung unang-una. Pangalawa would be our border controls. Pangatlo, pag nakarating na sa komunidad, na andyan yung PDITR response natin. And of course, the last, individual behavior, which are minimum public health standards. So lahat ng ito dapat ipatupad para makontrol natin ang pagpasok o kaya ay ang pagkalat ng mga ganitong variants of concern dito sa ating bansa.
Thank you po, Yusek. From Lay Alvis, Dr. Ronjean Solante recommends that NCR and other high-risk provinces remain under general community quarantine until December, when the government expects to have vaccinated 40% of the population. Ano daw po yung masasabi natin po?
Pag-uusapan yan, ano? We have parameters that we use. And katulad ng lagi nating sinasabi, sinasabi ng ating mga eksperto, we have to learn to dance with the virus. So kung tayo lang po ay makakapag-comply maigi sa ating minimum public health standards, unti-unti tayong pwedeng makabalik, no, dito sa sinasabi nating new normal na tinatawag natin. kailangan din po natin isaisip na ang ating mga kababayan ay kailangan na rin sabik na sila with this new normal na meron, and with the cooperation of everybody, we will be achieving that, especially now that we are all being vaccinated. Kailangan ho nating ibase sa science pa rin at sa ebidensya kapag tayo ay nagdidesisyon kung tayo ay magkakaroon ng community quarantine classification level. Meron ho tayong parameters na sinasagawa at dito po natin binabase. So hindi ko po masabi ngayon kung hanggang December ay dapat naka-GCQ tayo dahil marami pong implikasyon ito pong mga community quarantine level classifications na ito. Pangalawa, naghahanda na po kami dun sa aming data analytics small working group or technical working group under IATF. Pinag-uusapan na namin with the economic cluster kung paano tayo magta-transition dito po sa mga ginagawang community quarantine classifications, kung saan magkakaroon po tayo ng mga thresholds para malaman natin kung kailan dapat itinataas na ang restriction, kung kailan dapat local governments na ang magsasabi kung ano ang level of classification nila or risk classification, para hindi na po buong region o kaya buong probinsya ay naisasara because of these different trends in the number of cases. So antayin po natin yan. Wala po pa kaming certainty sa ngayon at we can recommend that until December we can do GCQ. These are being discussed by our experts and also being discussed with the IATF.
Thank you, Yusek. From Lay Alvis, sa Samar, I think sa Tacloban City ito, Yusek, may mga bakuna raw po na dinala sa bahay ng isang politiko. May update na po ba sa investigasyon dito?
Well, pinag-aaralan natin yan. Pag may mga ganitong report sa atin, iniimbestigahan po natin yan. Naantayin po natin ang report na ibibigay sa atin galing po sa regional office namin dyan sa lugar na yan. Gusto lang po namin magpaalala sa lahat para po sa ating mga kababayan, bantayan natin yung mga bakuna natin. Para sa atin pong lahat to, it is really very important na kahit isang dose ay mabantayan natin para po hindi po mapunta sa waste ang ating mga efforts at saka magkaroon po ng bakuna ang lahat ng nangangailangan. Para naman po sa ating mga local government officials, sana po ay tayo po ay magtulong-tulong. Iwasan po natin na magkaroon ng mga ganitong pagkakataon dahil nawawalan po ng tiwala ang ating mga kababayan kapag mayroong mga ganitong reports. We are trying to verify these reports. Hindi ko pa masabi kung ito ay totoo o hindi. Kailangan pa rin po namin ma-receive ang official report so that we can act on it.
Thank you po, Yusek. A follow-up question po from Sheila Crisostomo. Bakit daw po mataas ang kaso sa less than 2 years old?
Ang less than 2 years old po na pinakita natin, actually it's the less than 1 year old at pinag-aaralan po talaga to. But of course, we will assume na sila po talaga yung closely monitored or closely cared for by their mothers at maaring dun po nanggagaling ang infection. That is an assumption. Pinag-aaralan pa po kasi ng ating mga eksperto kung bakit mas mataas ang bilang ng mga kaso dito po sa mga less than 2 years old. We will provide information once we have it already.
Thank you po, Yusek. From Bons Magsambol, Yusek Vergeres said that developmental stages of children are being affected by the lockdown. That's why DOH approved kids to go outdoors. What about school opening? Is the DOH also recommended the gradual reopening of schools?
Yes, Bons, nakikipag-usap na kami sa Department of Education for weeks already, kasama ang ating mga child health experts. Kung saan ito rin ay napag-usapan dito sa aming pagpupulong with this small working group with DepEd and the child health experts, itong paglabas ng mga bata. So actually, this is really in preparation also when we do our pilot face-to-face classes na pinag-uusapan sa ngayon at ihahain natin sa IATF para magkaroon ng approval.
Thank you po, Yusek. From Aiko Miguel, in Belgium, an unvaccinated 90-year-old woman died after falling ill with COVID-19. She was infected with both the alpha and beta variants, according to the researchers. Is this really possible, especially among the unvaccinated population? Do we have any reported case here in the Philippines which a person was infected with 2 variants?
Well, nakasaad naman dito sa article na to, Aiko, na pinag-aaralan pa yung possibility of co-infections with different variants. So antayin po natin yung full evidence and pag-aaral ukol dito. Sa ngayon, dito sa country natin, wala pa po tayong nadidetect na mga tinatawag na apparently co-infections with 2 variants. Dito sa atin, one individual shows one variant. Magsasabi po tayo pag meron tayong mga ganitong nakikita at of course, pag-aaralan natin mabuti.
Thank you po, Yusek. I think gusto lang po ulit ng clarification po ni Bons regarding po sa recommendation kung recommended na po ba natin ang booster shots even po sa mga health workers?
Not yet, Bons, no? So, kailangan natin, gusto ko lang ipaalala, no? Kasi napakaingay na itong booster shots na ito. Ang objective ng booster shots is to boost our immunity. Pero para masagawa natin to, kailangan natin ng sufficient evidence para masabi natin na ligtas talaga ito para sa ating mga kababayan. And sa ngayon, wala pa ho tayong kompletong ebidensya regarding these booster shots. Meron pong mga pag-aaral na ginawa sa abroad, but these are other platforms na hindi naman commonly used ang bakunang yan dito sa ating bansa. And you all know that these are studies for AstraZeneca, for Pfizer. Wala pa ho tayong sufficient evidence or study na meron talaga na booster for the other vaccines that we have in the country. Pangalawa, gusto ho natin i-emphasize, even for healthcare workers, we are still not recommending for now these booster doses. Ang atin pong principle for that is equity, no? Aside from, of course, waiting for the evidence, and gusto lang muna natin makataas-taas at mabigyan ng bakuna ang mga taong dapat bigyan ng bakuna sa ating bansa bago po tayo makapag-isip at makapagbigay ng rekomendasyon regarding booster doses. Meron ho kaming sinasagawang survey, pinag-aaralan na po ang mga naging resulta among our healthcare workers in Metro Manila. And we all know that healthcare workers, most of them received Sinovac and AstraZeneca. At lumalabas po dito sa aming mga initial na pag-aaral dito sa mga datos na ito, na ang ating mga healthcare workers ay bumaba po ang rates of infection, wala po nagkaroon ng mga severe and critical na infection. At ito po ay magandang palatandaan para ipakita at ipamahagi sa ating mga kababayan that itong mga bakunang meron tayo sa ngayon is effective and it's going to protect us from severe infections and hospitalizations.
Thank you, Yusek. I think we have our last question na po from Lay Alvis. Congressman Ronaldo Zamora said that after his 2 doses of Sinopharm, he was inoculated 2 more times that served as booster shots. He did not mention the brand po. May we ask for a comment from DOH as this may give the impression to the public that they too need to get their booster shots?
Well, unang-una, Lay, hindi kami na-inform about this matter. This was something that they did between the individual and his physician. Gusto lang ho namin magpaalala na again, papaulit-ulitin ko, mixing and matching at saka booster doses ay hindi pa po nairerekomenda sa ngayon ng Department of Health at ng mga eksperto dahil hindi pa ho kumpleto ang ating mga ebidensya. Nabanggit ho minsan ni Dr. Nina Gloriani ng ating vaccine expert panel na baka ba towards the end of this third quarter, lumabas yung malaking study na sinasagawa sa ibang bansa regarding this and maybe we can give recommendations already. Pero sa ngayon, hindi pa po. So gusto ho natin magpaalala, lalong-lalo na po sa ating mga kababayan, na sana po wag muna po tayo mag-embark dito sa mixing and matching yung sa second dose ng ibang brand o di kaya yung nagpapa-booster dose dahil hindi pa ho yan recommended ng ating mga eksperto. Pangalawa, nagpapaalala ho tayo sa ating mga physicians, sa ating po mga medical professionals na sana po ay sumunod tayo, mag-align tayo sa protocols ng gobyerno. Ito pong protocols ng gobyerno, base rin po sa siyensya at ebidensya at ito po ay makakasiguro na magiging ligtas at magiging effective ang mga ginagamit nating bakuna para sa ating mga kababayan. Tandaan po natin na meron po tayong Emergency Use Authority galing sa FDA. At kung ano ang nakalagay sa EUA, yan po ang magiging gamit ng bakuna. So mag-iingat po tayo dahil pag meron tayong violation sa mga ganito ay maaari po tayo magkaroon ng sanctions.
Thank you very much po, Yusek. Before we officially end our media forum, do you have a final message po para sa ating public?
Yes, gusto lang ho natin pasalamatan uli si Director Ronald Lo sa pagbabahagi sa atin ng mga importanteng information tungkol sa health resilience in the new normal, kasabay ng pagdiriwang ng National Disaster Resilience Month 2021. Sa pagtatapos po ng ating media forum, nais din po nating ibahagi sa ating publiko na bagamat nakakakita po tayo ng mabagal na pagbaba ng ating case trends, hindi pa rin po ito sapat na rason para tayo ay maging complacent. We are in a race against the variants threatening our country. Sa paghigpit po ng ating border control sa lahat ng ports of entry sa ating bansa, dapat po pag-igihin po natin ang pagsunod ng ating minimum public health standards at ang pagpapatupad natin ng PDITR strategies. Mga paraan po ito na naging epektibo na sa pagpigil ng pagkalat ng COVID-19 sa ating bansa. Kasabay po ng ating pagpapalawig ng ating mga response na ito ay nananawagan po kami na patulunin ang ating COVID-19, palawigin po natin ang ating COVID-19 vaccination program at bigyan po nating priority ang ating mga sektor. Please, ang ating po mga senior citizens at saka yung mga taong merong mga sakit or comorbids, bigyan po natin sila ng priority para makumpleto na po natin ang pagbabakuna sa kanila at makakabawas po ito sa burden sa ating health system kung sakasakaling tataas po ang mga kaso. Patuloy din po natin ang paghihikayat sa mga eligible population na hindi pa po nagpapabakuna at hindi pa rin po na kahit man lang nagpaparegister. Magpabakuna na po tayo dahil ito po ay makakaprotekta hindi lang sa inyo, pati rin po sa inyong pamilya. Alalahanin po natin na sa pag-iingat, hindi lamang po ang ating mga sarili ang ating napoprotektahan, kundi pati na rin po yung ating mga mahal sa buhay at ang ating komunidad. Ipagpatuloy po natin ang ating pagkakaisa sa pagiging bida solusyon plus kontra COVID-19. Nang sa gayon ay umangat at maghilom tayo bilang isang bansang Pilipino. So maraming salamat po sa inyong lahat. We will see all of you on Friday. Salamat, Lindsay.
Thank you very much, Yusek. Thank you very much to our media partners. Happy Monday po and ingat po tayong lahat.